All right, thank you for joining us here on The Mindset. I'm Christopher Feltner, training architect with Ukeru Systems. And we have a special guest here today, all the way from Sioux Falls, South Dakota, Jon St. Pierre, trainer of George St. Pierre from the UFC. So I'm curious, with that last name, how many times have you heard some sort of joke or question?
You know, I get asked a lot by our students. That's who usually asks if I'm related to him. So I may have told a few kids that I am, but yeah, that started, you know, when he was really at the top of his game. A lot of kids would ask me if I was related to him.
Hey, you know what? If it works, sometimes you got to make up some stuff.
Yeah,
you know?
That's right. That's right.
The improv of our field. So
yeah,
Jon,
that's right.
So Jon, if you don't mind, just to start, tell us, the people who are watching, listening, who you are and what you do.
Okay. I am the executive director of two of our programs here in South Dakota. We have one of them is called Brighter Transition Youth Treatment Center. And with that program, we are actually getting ready to celebrate our 10-year anniversary.
Nice.
Next week on June 3rd. So we're excited about that. And then we also have another program on campus that we started in 2018 called Falls Academy. So Brighter Transition is a all-boys program. All of the youth in that program come to us from the Department of Corrections. And that is the program is designed it's their last step. It's to get them ready to go out into the community. Some kids go home, some kids, go to the military. We have a young man who is heading off to the military here pretty soon. A lot of kids get their own places to live, going independent living. And then Falls Academy is more of what we call a front end program. And that's some younger kids that maybe are just coming into the system, have never been in placement before. And that is actually, we have a boys unit and a girls unit there. So we have two pretty distinct programs on campus that address a lot of different issues with our kids.
Mm-hmm. So let me ask, how long have you been in this field now? I
started as a direct care staff in 1999. So It's been a while. So yeah, I worked 3 to 11, Wednesday through Sunday. And if you'd have asked me 24 years ago if I'd be still doing this, I wouldn't have told you yes at the time, but something hooked me, and here we are today. I was fortunate to just start at that position and move up to where I'm at now. So I've held a lot of different roles within our programs, and very fortunate to be where I'm at today.
So you started right during the whole Y2K. Remember all that?
I did.
Where everyone thought that the year 2000 was going to take us all out.
And luckily, pretty much everything we do now is computer based and internet based and EMDR electronic medical records, EMRs. And back then we didn't do a lot with computers and obviously not a lot with cell phones either. So it ended up being a lot to do about nothing, but still people were concerned. But I think if that were the case today, it'd be a lot different feeling just because everything's so computer based.
Mm-hmm. So if you think about the way that we think about the folks that we serve now, like the mindset and approaches in this field now compared to when you started in 99, what have been some of the differences you've noticed from when you first got into the field to where it is now?
I'll tell you that the biggest thing, and it's interesting that you asked that because I just had this conversation with my staff the other day, is trauma-informed care. Mm-hmm. And I think that's probably the biggest change. I didn't even hear the term trauma-informed care until probably about 6 or 7 years ago, mm-hmm. because it wasn't something that was focused on at the time. And it was, kids would come to us and they were going to be there for a year, and it was there wasn't a lot of therapy. There wasn't individual counseling. Yeah. It was all group. So I look back on those times, and so a lot of the things that we were taught and told, just they don't match up with what we do today.
Right.
So I think when we talk about what's the biggest change, it's understanding that our kids have been through a lot of trauma, and what's the best way to help them, and what's the best way to treat them, and when you start getting into that, you start realizing it's not just the kids you're around that have their trauma, but the adults around have their trauma too.
Yeah.
And you have to be mindful of that when you're working with kids and with staff, that everybody's got their own piece of trauma, and how do we help them, with that, and help make the kids as best we can, and help the staff as best we can.
Mm-hmm. I've talked to some folks on here in recent episodes that are from school systems, and sometimes we'll hear that at conferences and stuff when we talk to folks. Well, I could see this working in a school setting, but in a residential setting, we serve this type of kid, and they go to describe them and all. For you, how many years has this been now, do you think, that you've been implementing Ukeru in your programs?
We just got done with our third recertification, so for 3 years. So we're going into year 4 now.
Gotcha. So think back when we first trained together. It was you and it was another facility together. What was your thoughts or beliefs about what Ukeru was when you went into it, and what has been your perception since now that you've implemented it in your programs? Any change in how you've thought about things since then?
Definitely. I think when everybody first went into the very first training, and even the other program we were with, it was all about the blocking pads, and that's what it was. And we were going to learn how to use these blocking pads, and that was it. And I remember sitting in that training room while you were training, and people kind of saying, "Well, this isn't going to work. This isn't going to work." And how, and there's just so many questions. And then what starts to happen is you realize it's not just about the blocking pads. Right. That's a component of Ukeru. But when you start getting into the theory and the practice and the principles, and again, starting in 1999, that was the first exposure I had to how the brain works, and how trauma affects the brain, and how trauma affects your behavior. So when we started getting into that, it starts to click. And so then that gets you really bought in. It's not just about the pads. There's a whole other piece of this that you can utilize before you even have to get to using the pads. Mm-hmm. And so once you start hearing that piece of it, it gives you more tools. It gives you more tools to help our kids.
Yeah. So now you're executive director of your programs. You've gone through this training as a trainer, and now you and your team, which your team personally, I feel like you have one of the most solid teams around you to do this thing. When people ask me, what are some good solid leadership teams you've seen? Your crew is always one that comes to mind. Folks that are very personable, but also very firm, we're doing this thing, whatever that may be.
Yeah.
So now when you went back to start the implementation, like you said in the beginning, some of the folks that you're serving are ones that basically, if this doesn't work out, it could be prison for them, or back to juvenile detention, whatever it may be. How did you go about implementing a program, especially looking at comfort versus control and a lot of things that misperceptions with that at first? How did you combat the staff mindset of, these are delinquent kids, this comfort versus control, what are you talking about? How did you even begin to tackle that?
Well, you kind of started it with the team I have around me. They're fantastic, and they're very loyal to each other. And once we all understood this is going to make us better, it's going to make our campus safer. Mm-hmm. It's going to make our kids safer. It's going to make our staff safer. Once they were bought into that, it was a real easy sell then to the rest of the staff. Mm-hmm. And so, there was a couple people that were resistant, and they kind of worked themselves out of being here, working here. And that, I think that's going to happen all the time.
Yeah.
But it was a pretty easy sell when you know, instead of going from, you know, a situation you might be in with a student to a restraint, well, now you've got another piece in there that you can utilize to try to avoid that restraint and try to avoid having to put your hands on a kid. And so once they saw that, it was a pretty easy sell at that point. Mm-hmm. And now it's just you know, it's just the pads are there, and you hear a language and kids talking about it and staff talking about it throughout the day, and it's not even a, you know, no, there's no pushback. The kids know, you know, the kids see the pads, and a new kid might come in and ask about it, and literally what the staff will say, well, that's, you know, we don't want to put hands on people and we don't want to restrain people, and this is the way. And the kids are like, oh, okay, and they go on with their day. And I think one of the things that it really did for us is that, you know, a lot of times you would hear from kids, you're just here to restrain us. Mm-hmm. And I've heard that at other programs too, not just here, but if you go and you go to other programs and talk to kids and be like, oh, staff just wanted to restrain us. Well, now you have visible proof all over campus that we don't. Yeah. And so when the kids started to realize that, our restraint numbers dropped drastically. They've been reduced by almost 70% over the last 3 years. And so when the kids had that mindset too, it's like, well, staff don't want to put their hands on us, and that you could just kind of feel something over campus where it wasn't tension, but it was kind of a release where kids probably felt safer, staff felt safer. So that was the biggest thing that I think I noticed right away. Mm-hmm. And you know, the proof's in the pudding for us when you look at our restraint numbers. It obviously has made an incredible difference.
Yeah. And I'd also say for viewers, if you would like to see more of the actual data behind it, there is a case study that you all did with us. So they could check that out under case studies on our ukerusystems.com site. So you've got this implemented to your program. Folks are familiar, they're comfortable with it. You're seeing what you've seen as far as success with it. But then COVID hits. Yeah. And you start losing staffing and everything else. I want to ask you a couple questions, two-part question to that. One, how did you manage to keep your core team versus losing them during that period? And also, how did you manage to keep trauma-informed practice during a time where things got even more chaotic and you might as well say traumatic, even more so for staff dealing with life and coming into a field that's hard?
I think as far as keeping the staff, there was a lot of conversations because, of course, when you know it first happened, there's a lot. You know, the news was different every day, and what you were hearing was different every day, and there was just a lot of you know, conversations with people, leaning on each other and helping through it, and we made it quite a while. Through the pandemic without it hitting our campus, which we were pretty happy with. Yeah. So that I think that helped a lot too, is that it didn't hit us right away, and then people were out and kids were sick and staff were sick. So it was a little while before it really hit our campus, and so I that was the biggest thing I think that helped. Had we come out of the gate and it had kind of taken over campus, it might have been different just because of what you were hearing on the news. But as it went on and you started to see some changes, and one of the things too in South Dakota is South Dakota really didn't shut down. Mm-hmm. Our you know, nothing here shut down. In fact, the state government was saying, move to South Dakota, we're still open. And so I think that helped too, because people knew that, you know, their jobs are safe and they had a place to be. And even though other places were closed and no one was hiring, they you know, had some comfort in the fact that we were open and they still had their jobs and we still had to take care of each other. And I think that was, you know, some of the few things that happened is we were just kind of able to, we had to change, you know, things. Obviously we had to change our tactics with some things, and and all the staff wore masks, and we didn't force the kids to. We didn't want to get into a power struggle with the kids that you have to wear masks. And
Right.
but kids that showed symptoms did, and we had areas that we can quarantine kids if we had to. And so, but it was a lot of just really leaning on each other, and somebody would come in every day, and I heard something different on the news last night about COVID, and then it would change today. So, but we it was interesting when it kind of, I guess you could say, ended. Mm-hmm. It was, when you look back, it wasn't like it was exhausting going through it for people. Yeah. I guess is what I'm saying. People didn't feel like, oh my gosh, I'm glad it's over. I think the staff did a great job of handling it, and if someone was sick, they would say I'm sick, and so it was nice too that the state kind of loosened up a little bit around like ratios with staff ratios with kids, so that made it easier to staff places we needed to staff, and they made a real concerted effort to help providers in the state, knowing that you're going to have people out and people sick, so that helped a lot too.
Gotcha.
Yeah.
When thinking about your program, I'd often use one of your girls' units as an example when I train, talking about the ceiling tiles.
Yeah.
So tell us about what led to, give that story about the ceiling tiles. I don't want to give away details in case people have never been trained by me and haven't heard it. So
in all of our dorms, there's a drop ceiling, so there's ceiling tiles, and on the girls' dorm in particular, one of the staff said, hey, they came and said, what do you think about us painting the ceiling tiles, putting art, letting the girls kind of put their own little spin on it? And of course, your first thought is, oh my gosh, what are they going to put up there? And is there going to be gang stuff? Is there going to be inappropriate things? And they assured us that it would be appropriate. And then I walked in one day, I think there was 12 or 13 girls on the dorm, and they were showing me what they were painting on the ceiling tiles, and I was just blown away. First of all, how good of artists they are, but it was things that were personal to them, and that's what made it really neat, is that they're just not they're painting something that's meaningful to them, and it might be in memory of somebody, it might be a saying that relates to them when things get tough. Here's what you got to do. So they really were able to take one of those ceiling tiles and personalize it to them. And I think that's what made it really cool, is that no one told them, here's what you have to paint on there. They would take something that was meaningful and put it up there. And we're kind of at a point now where we've run through all the ceiling tiles, and now the new girls come in and will replace one that was there from a past student from a couple of years ago, because every girl has stuff up there. And it's neat to walk in and see some of the tiles of girls that have been here, that have been gone for a couple of years, and see what they put up there. And they've also, some of the girls came and grabbed some of the ceiling tiles out of my office and painted those, so they're up in my office too. And what was really kind of cool is now the boys started doing it too. The boys wanted to.
I was wondering, yeah.
Yeah, the boys wanted to do the same thing. So it's not as colorful and as the girls' dorm is, but the boys' dorms have taken to it a little bit. You've got some kids that have some ceiling tiles, and they've done it in their rooms. They like putting them up over their beds, and then they can, like I said, whatever is important to them or personal to them, they can see it when they're in their rooms. So, but it was a neat thing, and there wasn't really no direction with it. There was no, here's what we're going to do. They just wanted to do it, and so we let them, and it turned out to be a pretty neat thing.
Very cool. Yeah, I wondered, because each time I go there and I've walked through, I feel like the ceiling tiles in the girls' unit is just more and more and more art pieces. And I was curious. I was curious about the boys if they had started doing that as well.
Yeah, they've started to do a little bit. And every time I go on that boys' dorm in Falls Academy, you see a little bit more in there. But yeah, the girls, it's almost something the girls work on almost every day. That always need more paint and more paintbrushes, more ceiling tiles. So we've bought a lot of ceiling tiles too. So they have them to paint, but it's really cool how it turned out. It makes it real colorful in that dorm too, which, people always remark when they come in that have never been to campus how much they like it.
Mm-hmm. Any other creative things like that have done around either environments, programming, anything that's not exactly textbook?
The other thing is that's happened, and when you walk in the girls' dorm, it's moved from the ceiling to the walls, and so kids will. Some of the staff offices in there, they've come in and painted it like a mural on the staff office walls. They have done some of the hallways too. So it's just, I think it's therapeutic for them to do that too, but also they like the way it looks, and I think the girls really kind of take a sense of pride when they can go into one of the staff's offices and paint a mural on the wall for them. And then the staff don't say, here's what I want. The kids just put it up there, and it's pretty neat how it's turned out. Yeah.
There are a couple of things I've been thinking about more recently, and one of the things I wrote about in the last blog I did for our site was how sometimes our focus on compliance creates individuals being dependent on the system.
Yeah.
Right. So, especially if you work with a lot of adjudicated youth, what are some ways that we end up inadvertently conditioning individuals for the system in our practices, past, present?
Well, I think that one of the things when you talk about like past, and I think about my career and where, how we started the podcast from where we've come, kids would come in to say, I'm doing time, right? I'm here. I got to be here for a year. And they treated it like that. And then what ended up happening is the staff kind of treated it like that too. It's like, oh, you're going to be here for a year. It doesn't matter what you do in that year. You can have a really rough year and you're still leaving
right
on that date. And so that conditioned the kids to you weren't really pushing them to I guess, for lack of a better term, get any better. And how do we make better choices when we're not here and we're not in this structure and we're out in the community? How do we make better choices? And it was really just serving time. And it felt like that for a lot of years. And kids knew, the date I got here, I'm leaving from 1 year today, and I really don't have to make any progress. I don't have to do my groups. I don't have to do education because I know when I'm leaving, And now what's happened, and there's an incentive then for kids to come in and do their groups and do their individual therapy and do their education. And we really make a big deal too of just community access and being in the community. And that's a part of their program. And we actually build that into their goals. When they come in, it's like, you can't just sit on campus for this amount of time.
Right.
And you go home, you have to complete ART, or you have to complete 7 challenges, which is our chemical dependency group, or you have to complete MRT. And then there's an incentive for those kids to go through that and really make, remarkable progress because we're measuring that. We're measuring from the time you came in until, points through your stay and when you leave, and you have to show progress. And it just was never like that before. It was, like I said, kids just felt like they were doing time, and now, staff were able to kind of, push the kids in the right direction. And if they don't do it, they don't do it, but there's, like I said, there's that incentive there, and kids do it in their own time too. Some kids come in and do it a little quicker. We had a boy yesterday that he finished his GED yesterday, and he's been here for about 7 or 8 months. And he looked at me and he said, "I wish I would have done this sooner." And he admitted, I kind of messed around for a while, and then I didn't do anything. And then all of a sudden, he, in the last 2 weeks, he buckled down and got his GED, and he just said, I wish I would have done this sooner. Yeah. And so kids do it in their own time.
So what are some of the community exposure opportunities that your folks have on your campuses?
Yeah. So in our transition program, the expectation is they get jobs in the community. And so we have a lot of kids that work at all sorts of different places in town here in Sioux Falls. They work in restaurants, they work in stores, they might work. We have a big Amazon fulfillment plant here, and we've had kids work at Amazon. So, we want them to get those jobs, keep those jobs, teach them, how do you dress, how do you do an interview, all those things. You just kind of help walk them through it all, and so that's one of the biggest pieces for the kids in transition is getting that job. And then we also have some places in town. They love to go swimming. Of course, they love to. We have a trampoline park. They love to go to the trampoline park. They'd go there every day if we let them. But they like getting out and in the community and just being kids. And that's, and we can teach them when we're out with them is, here's how you have to kind of conduct yourself in the community. And maybe the way you were doing it before, you didn't, and the kids will say, I didn't like the way people looked at me. I always felt like I was looking over my shoulder when I was in the community. And we can teach them with this community access that you don't have to do that. If you go out in the community and here's kind of how you conduct yourself. And the other night, the girls got out of school and they went all in the same night. The entire girls dorm went to the movies. They went to the trampoline park, and then there's a gaming and laser tag place they went to too. So in one night, they hit all three of those.
Wow.
The entire dorm did. And so, that it's fun for the kids. Of course, it gets them off campus. They like that too. But then you're just able to kind of teach them those pro-social norms that exist, and it's a good, valuable teaching moment. And people will say, "Why do you take those kids to town?" Well, they're going to be out in the community at some point,
right? And
if we can kind of teach them, here's kind of what you have to do when you're out here, that makes a big difference.
Yeah, because a lot of them have been through multiple placements, right? Or they've been made to believe that there's no other place for you. Like, you will always be in the system. And if you treat someone like that, they're eventually going to believe it, internalize it, and act upon it, right? So at some point, someone's got to give them a chance, right? Yeah. Somebody's got to give them a chance. Now, keeping in mind all the cool stuff you just talked about they get to do, what in the world did you all do during COVID?
Yeah. So, again, had to get creative with some of those things. And like I mentioned earlier, a lot of places still stayed open, but they had their protocols in place and they had their precautions in place. And of course we followed them, as we went places, but there wasn't a lot of places that just absolutely closed down and said, we're not going to be open till this is over. So they put their protocols and precautions in place, and we followed them. And now the swimming pools were closed. The kids loved to swim, and so the swimming pools were obviously closed. But some of the other places that we take them, they stayed open. And if they required a mask, the kids wore masks. If whatever they required, we did, and the kids did. So that made it nice, because it didn't just completely shut us down and leave us kind of stuck on campus and trying to figure out what to do with them. So that made a big difference for us.
Yeah. I got to admit, when I think of Sioux Falls and the times I've been there, it has always been cold, and almost every time it's been snowy. So when you talk about swimming, I'm like, I can't picture a swimming pool.
Well, we have a really nice indoor swimming pool here too. So
Gotcha.
It's a great facility. So we're able to take the kids there. That's another place they'd go every day if we let them is the indoor swimming pool. So, but yeah. You should come now. It's nice now. It's about 85 degrees and real sunny. So
nah, they'll wait and send me when it's like January.
Yeah,
that's usually
the worst time of the year.
I remember last time I was there was a lot of ice.
Yeah,
there's a lot. So I did a lot of slipping and sliding on a lot of the backcountry roads and stuff there. So It was
We
interesting.
had a really, really rough winter this last winter here.
Yeah. Which, contrast for us, we actually had an unusually mild one. It would get cold, but as far as like winter weather, it really, which is funny because the Farmer's Almanac and all that would say that, oh, this is going to be a bad one. And yeah, not so much.
Or it's going to be mild, and then it's not.
Right. Not so much.
I think, Christopher, one of the biggest, you're talking about COVID, and I think one of the biggest struggles that we had, and I thought about this the other day with COVID, was the masks and staff wearing masks, and it kind of felt like there were some connections lost maybe between staff and kids, because kids couldn't see your face and they couldn't see how you were reacting to something they were saying. If it was something maybe they got some bad news and they were telling you about it, they couldn't see your reaction. And I think when we talk about what we struggled with COVID, I think that was the biggest thing. And I heard it from a few kids too, is they just kind of felt like you lost that connection, because anytime you were out of your office or around the kids, the staff would wear masks. And I think that was probably the biggest thing at that time period that was lost, was just some of those connections that the kids might have felt with the staff, and not being able to see their face and see their reactions and things like that. But that's probably the biggest thing that we struggled with. I know I struggled with it.
Yeah.
Because you didn't see your staff's faces for many, many months too. And so it's hard to kind of tell how they're feeling too sometimes when you can't see their face.
Right. So what are some goals, some changes that you're hoping to implement in your programs?
So the biggest thing is for us is trying to be 100% restraint free. I thought we were going to make it this month. Today's the 25th. We've had one restraint in the month of May. But that's my goal. I think that's my team's goal too, is to just get to a point where it's 100% restraint free, and everybody knows that, and the kids know that, and the staff know that when they come in the doors. This isn't a place. The kids would say this isn't a place where we get restrained. So, don't put yourself in that position. And then the staff, they don't want to put their hands on kids, and
right.
And that's already there. So I think getting to a point, and that's easier said than done. I mean, it
absolutely.
just is. But if you can build that culture where kids know that it's not going to happen, and staff know it's not going to happen, and we're not going to do that. Now, if I can figure that out 100%, then that would be, I'd share it with everybody. But that's our goal, is to get there, is to get to a point where we're just 100% restraint free. The other piece is, we have seen over the last probably 4 or 5 years more kids with higher mental health needs, more acuity in the moment. So always looking for, with our clinical director, with Wendy and her clinicians, what's out there that we're missing, maybe that we can incorporate into our program that will help kids with their trauma, that'll help, get them through. We do EMDR. We've also had one of our therapists trained in brain spotting, which is kind of the new EMDR, and she's really excited about the outcome of that.
Explain that. What is that? I'm not familiar with that one.
So brain spotting, and she's described it to me. She's a lot smarter than I am. So she's, it's really more about finding those triggers that maybe you don't even know exist. And kids are triggered, their trauma's triggered by something, and if kids can identify what triggers that, then they're able to kind of work through those things. And so you're digging deep to find triggers that would make that trauma kind of come to the surface. And then when you can do that, then you're able to identify, oh, something's coming on, and I've got my coping skills, I've got my safety plan, and I can, use that to identify, rather than all of a sudden it's here. I don't know how to stop it. My trauma response is here. And usually that means I scream, I yell, I punch the wall, I destroy things. Hopefully we can kind of interrupt that at some point and prevent them from getting there. So anything we can do to, bolster that clinical department and then, helping our staff understand, the staff that are with the kids 40 or 50 hours a week, getting them to understand those things that they can do in the moment too, because your therapist isn't always here, right? And so getting whatever tools we can give our staff that we're with the kids all the time is always a goal of ours.
So Jon, you've talked about instituting more trauma-informed care practices and a lot in terms of the folks that you serve. Any things that you've implemented, changed, or added that help with staff trauma?
Yeah, so we've been spending a lot of time with staff doing just kind of inadvertently at first, but now kind of purposely, when you do trainings with staff and you're doing Ukeru or you're doing some of our other things we do, they start to realize that, oh my gosh, I've been through some of these things and I didn't know, I have my own trauma.
Right.
And so and they're not afraid to tell you. The staff will come and say, hey, I've been through this. I didn't realize this is what was going on, but I've been through this. And they'll ask you, like, what do I do? How do I? And our team, our administration team, our clinical team, they're real good at being able to help people kind of identify that, the staff identify that. And I think a lot of times just them talking about it has helped a lot. But it's pretty interesting when you start going through some of our trainings, how the staff are able to identify that, oh my gosh, I have trauma too, and I didn't even realize it.
Yeah.
And how does my trauma, if I bring it here, how does my trauma affect the kid? And the biggest thing is hard, but we don't want people to come in and bring their trauma and put it on the kids. And now the kids have not only carrying their trauma, but now they're carrying someone else's trauma.
Yeah. So Jon, one more thing I want to ask you here. If you were given a magic wand, right, and you could change one thing to improve the field of mental and behavioral health, what would it be?
I think that, and this kind of brings me back to thinking about the course of my career. And this is one of the things I think that is, I don't know if it's lacking or if it's just circumstances, but caregiver capacity. So once our kids, they're with us and the kids with you for 3 months, 6 months, 9 months, however long that is, they've made significant changes. And then a lot of times they go back to an environment that hasn't changed. And so, and that's the hardest part, is knowing, and a lot of times we have kids that say, I have to go live here, but I don't want to live here because I know what's going to happen. And unfortunately they're in a position where they don't really have a choice. Sometimes they have to go back to wherever that is. Yeah. And so if we could somehow increase that caregiver capacity, and we do family therapy and we work with families but sometimes it's just not enough. And I would love to be able to send a kid back knowing that not only have they changed, but the environment has changed. And that's the hardest part for me, is knowing a lot of time and work you put into a youth, and they know it, and they look at you and say, I know what I'm going back to, and I'm going back to the same thing I came from, and I've made all these changes, but I know where I'm going. They haven't made these changes. So that's what I wish in this field, and it's not just while the kid's with you, but after they leave, and so I think it's got to be holistic and being able to treat everything, and that's hard. It's incredibly difficult. Yeah. So that's for me the biggest thing.
All right. Well, Jon, I certainly appreciate you taking the time to talk to me here today. Now that we got now we got all of our kinks worked out, we're able to have a conversation. So.
That's right. Appreciate you having me.
Yep. Take care, and I'm sure I'll see you soon.
Absolutely. Thank you.
All right. Take care.
Bye-bye.